Alright, so we're still in Chapter 7. We're looking at controlled substances, Part 3, and we're on page 122. We're in the 8th edition of the California Law Summary for CPJE. So, all controlled substance prescriptions are valid for 6 months and must include the prescriber's DEA number. A controlled substance prescription must be dated and signed by the prescriber on the date it's issued to the patient. Pre-signing prescription blanks is illegal and has resulted in disciplinary action and suspension of a prescriber's medical license. Pharmacists should not fill prescriptions that are suspected to be pre-signed. Any agent of the prescriber, like a nurse or office staff, can orally or electronically transmit a prescription for a Schedule 3 through 5 drug. The name of the agent transmitting the prescription has to be recorded. So the first section looks at e-prescriptions or electronic prescriptions. When prescriptions are electronically transmitted through software, safeguards have to be in place to prevent unauthorized persons from hacking into the system and illegally transmitting controlled substance orders. The DEA permits electronic prescriptions for controlled substances. This includes Schedule 2 through 5 drugs. Prescribers and pharmacies have to use DEA-approved software to send and receive electronic prescriptions. The credentials that are permitted for DEA-sanctioned validation will be 2 of the following factors. Something you know, like a password or response to a question. Something you have, like a hard token containing cryptographic key stored on a hardware device separate from computer that's being accessed. And then something that you are. Biometric information like an iris or a fingerprint scan. Knowledge factors are easily observed, guessed and hacked, and used without the practitioner's knowledge. This is why a hard token or biometric information has to be used as well. Prescribers must use a 2-factor authentication method to sign and transmit electronic prescriptions for controlled substances. As an alternative to using 2-factor authentication to sign, the prescriber can use a digital certificate. A digital certificate has the user's credentials and is issued by the DEA. As of January 1st, 2022, all prescriptions for controlled and non-controlled drugs issued in California must be transmitted electronically. As of January 1st, 2022, all prescriptions for controlled and non-controlled drugs issued in California have to be transmitted electronically. Unless an exception is met, like pharmacists are not required to verify that an exception is met. See the Pharmacy Practice Part 1 Prescribing and Dispensing chapter for more information on e-prescribing exceptions. Written prescriptions and California security forms. A California security form must be used for all written controlled substance prescriptions, Schedule 2 through 5, with a couple of exceptions. As discussed later in this chapter. Prescribers can write a prescription for both controlled and non-controlled drugs on the security forms, or they can choose to use separate forms for each type. A California security prescription form must have the following features. The word void appears across the front of the prescription when photocopied or scanned due to heat exposure. Chemical void protection that prevents alteration when via chemical washing. A watermark is printed on the back of the prescription blank that reads California Security Prescription. Watermarks are not duplicated by copy machines. A feature printed in thermochromic ink which reacts to changes in temperature. Commonly, if a thermochromic image is touched or blown on, it will disappear and reappear after it cools. This effect is not duplicated by copy machines. An area of opaque writing that causes the writing to disappear if the prescription is lightened. A description of this security feature included on each form. 6 quantity checkoff boxes printed on the form. Must have the following quantities: 1 through 24, 25 through 49, 50 through 74, 75 through 100, 101 through 150, 151 and over. May be checked by the prescriber to correspond to the written quantity of the drug. A space to designate the units referenced in the quantity boxes when the drug is not in tablet or capsule form, like milliliters. A statement that the prescription is void if the number of drugs prescribed is not noted. The pre-printed name, licensure category, license number, DEA number, and address of the prescriber. Check boxes that the prescriber may use to indicate the number of refills ordered. The date of issue. A checkbox indicating the prescriber's order not to substitute. A checkbox by each prescriber's name when a prescription form lists multiple prescribers. A prescriber who signs a multiple prescriber form will need to check the box by his or her name. An identifying number assigned to the approved security printer by the Department of Justice. A unique serial number on each security form permits the form to be traced. The number has 12 characters and a corresponding barcode. The prescriber's serial numbers are reported to cures. Each batch of security prescription forms has a lot number printed on the form. The forms are printed sequentially, beginning with number 1. There are an increasing number of inappropriate security forms being brought into pharmacies and an increasing number of stolen security forms. The board posts on its website confirmed notices of stolen or compromised security prescription forms that have been reported by prescribers. A list of these can be viewed on the board's website. Hospitals often have physicians from the surrounding community who are granted privileges to see their patients at the hospital. Many hospitals have medical residents rotating through the facility for short amounts of time. Both types of prescribers need to write prescriptions and may not have their own forms for each hospital in which they work. For this purpose, the Board of Medicine and Pharmacy permit a designated prescriber at a facility that has 25 or more physicians to order security prescription forms for their facility that do not include the pre-printed prescriber information, which is prescriber's name, category of licensure, license number, DEA number, and address for the prescribing practitioner. These forms will be signed out by the designated prescriber in a record book that includes the name to whom they were given, the category of license and number, DEA number, and the quantity of security forms issued. The record must be kept in the health facility for 3 years. A written prescription for a controlled substance is exempt from using a security form in 2 instances. So these are the exceptions to using the California security form. So the first scenario is the patient is terminally ill, like they have a life expectancy less than or equal to a year, and the prescription is for medication to manage pain and other symptoms of terminal illness. In this instance, the prescriber would write 11159.2 exemption on the prescription form that's used. The second instance is during a declared emergency when the California Board of Pharmacy issues a notice of this exemption. The prescriber writes 11159.3 exemption, or a similar statement indicating the patient is affected by the declared emergency. No more than a 7-day supply can be dispensed for a Schedule II drug. Prescriptions filled pursuant to this exemption cannot be refilled. Oral prescriptions and faxed prescriptions, out-of-state prescriptions are coming up next. So oral prescriptions. So verbally over the phone, the pharmacist can reduce to writing and accept Schedule 3, 4, and 5 prescriptions. The prescription must include all information required for the valid prescription with the exception of the prescriber's signature. Oral prescriptions for Schedule II drugs are not valid except in emergency situations. Faxed prescription orders. Faxed prescriptions are acceptable for Schedule 3, 4, and 5 as long as all the information required for a valid prescription is included and the prescriber manually signs the fax before sending it to the pharmacy. Prescribers should use a regular prescription form to write the order. If the prescriber uses a security form, the text "void" written in thermochromic ink would appear due to the heat emitted by the fax machine during transmission. You can fill it as long as the pharmacist validates the fax prescription by contacting the office to verify first. In general, fax prescriptions for Schedule II drugs cannot serve as an original prescription. A prescriber can provide a patient with a written prescription for a Schedule II drug and then fax the same prescription to the pharmacy to alert them that this is on the way. This allows the pharmacy to fill the prescription before the patient arrives. The pharmacist cannot dispense the Schedule II drug until the patient brings the written prescription to the pharmacy, though. It has to be verified against the fax prescription before dispensing it. It is not acceptable, even as an alert, for patients to fax prescriptions to a pharmacy. The only time a faxed prescription for a Schedule II drug is valid is if it is written for a patient of a licensed skilled nursing facility, an intermediate care facility, a home health agency, or hospice facility. The pharmacist will need to produce, sign, and date a hard copy of the prescription before filling it. The next topic is on out-of-state prescriptions. In order to fill a controlled substance from out-of-state, an out-of-state prescriber, the prescription must meet the prescription requirements of the state in which the prescriber practices. And the prescriber must be registered with the DEA. The schedule of the drug will determine if the prescription can be dispensed directly to the patient at the pharmacy or if it has to be mailed to the patient. So if it's a Schedule 3, 4, or 5 drug, a California pharmacy can dispense it directly to the patient or deliver it by mail. If it's a Schedule 2 drug, the California pharmacy can fill the prescription, but then it can only be delivered mailed to an out-of-state patient. The drug cannot be dispensed directly to the patient in the pharmacy. The next two topics look at errors or omissions in Medicare Part D opioid limits on initial prescriptions. So all prescriptions for controlled substance have to be signed and dated by the prescriber. However, if the date is printed on the prescription, the prescriber only needs to sign the form. Controlled substance prescriptions have not been signed that have not been signed and dated can't be filled. For Schedule II drugs, the pharmacist cannot make any changes to the date, the prescriber's name, the prescriber's signature, the patient's name, the drug name. If there's a minor misspelling, it can be revised. The pharmacist or intern can make changes to any other information as long as the pharmacist verifies the change with the prescriber first. It is acceptable to verify with the prescriber if the void of quantity as not indicated has not been completed. The pharmacist can complete the form and fill the prescription when reasonable. Medicare Part D opioid limits on initial prescriptions. In an attempt to reduce the use of long-term opioids, Medicare Part D has limited initial opioid prescriptions to a 7-day supply. The prescription is considered initial if the patient has not received any opioid in the last 60 to 90